We want to remind you that every fourth Tuesday, we have two calls for the wellness team. They will be 11 a.m. Mountain Time and 7 p.m. Mountain Time. We're trying to reach United States, Canada, and Europe in the morning. And then for this evening's call, we're coming in right around 9, 10, 11 o'clock in Australia and New Zealand tomorrow. So we're offering this for both halves of the world. Welcome to the Vitify Wellness Call. This is Tuesday, the 25th day of March of 2025. We're already 3 months into this incredible new year, and it's just blowing right by us. So we want to make sure that we're sharing information pertinent to you and to your business. And there is no one better for sharing product information, ingredient information, formulation, research, studies. All of that info comes from our good friend, Dr. Cesar Fernandez, and the official invitation to him comes by way of, he is a medical professional. He is a MD. He is a surgeon. He is in ER support. He is an emergency room doctor. He is has been a member of his native Honduras's Board of Health, the National Board of Health. He has extensive experience researching stem cells and the value there. And he and Shane Brady had known each other before from a different company. And when Shane just kind of reached out and said, "Hey, we're doing something new," Dr. Fernandez, I'll let you tell that part of the story as the rest of your introduction. But ladies and gentlemen, please welcome, give him a bunch of thumbs up or a bunch of number ones in the chat to say welcome to Dr. Fernandez.
Thank you, Dave. Okay, good night, good morning, good afternoon. I'm not sure right now because I'm seeing here people from Australia, I think, Roberta, and I also see people from the US. Oh, I could see Jorge Delgado here. Hello, Jorge. Charity, Lori. Oh, Lori, here you go. And also, there's a bunch of people here that I get to know already, like Debbie, Jackie, Lisa, Lori. Hello, Lori. I remember you. Okay. So people are coming in. My name is Cesar Fernandez, just as Dave says, and I'm a medical doctor. But I'm gonna be here also as a medical doctor, but as a guy that have some amazing experience with this product. Okay, I've been having a bunch of patients, a bunch of colleagues, medical doctors also, that are finding these amazing things to support, not to cure or to treat, but to support all of the things that we are being struggling with throughout life. Like, for example, let me show you here a slide. For example, we could talk about having or living a painless life with nanocurcumin. How about that? How would you like to live a painless life? How many of you have been living with pain, have been struggling with pain, with chronic pain? You know, the worst thing that we could do is normalize pain, because we started with a mild pain and then it started goes up, and we're no, it's okay, it's normal. It's because my age, it's because what I do, it's because of my profession or my thing, but it's never normal. We are normalizing it, but it's never normal. And I'm going to talk today about how curcumin and an anti-inflammatory lifestyle could help you to control that chronic pain, you know, to make you happy. Could this makes you happy if you have no pain at all? Some people that when I talk to them, they just tell me, when I ask them, would you like a life, a painless life? And they says, does it exist, a painless life? People even says that they think it doesn't exist. So today I'm going to tell you what we're going to do. First of all, we need to identify pain. It's a signal from the nervous system that something isn't right. So stop normalizing pain. It's an unpleasant sensation. It could be tingling, burning, discomfort. It's never going to be good or pleasant. Never. Okay? But there's several types of pain. And we need to classify it. We need to put it in a chart so you could identify it and understand that some of them are not normal, but you could, okay, it could take time before I go to a doctor, but some of them you need to run. Okay, it's a nociceptive pain and neuropathic pain. It's the two main names that you need to remember. In nociceptive pain, there's a visceral and a somatic. In the visceral, it could be vascular or it could be your organs. For example, the vascular one, it could be a migraine, it could be a dissective aneurysm of the aorta, you know, so you're one and a half step in the other side. Ischemia, and it could be an organ, for example, your heart, for example, your pancreas, your liver, etc. When it's a somatic approach in the type of pain, it's basically a skeletal muscle, okay? Tendons, bursa, you know, the articulations, a ligament, a fascia. It's that type of pain. And the other one, which is a neuropathic pain, it has to be with the nervous system, specifically the nervous system, the central nervous system and the peripheral nervous system. When it's central, it could be a stroke. It could be a spinal cord injury. It could be even multiple sclerosis. But it's when it's peripheral, you know, nervous system pain, it could be diabetic neuropathy. It could be a neuralgia, a trigeminal neuralgia, for example, which is you know, the nerves in your face. And what happens is that it depends on where did it come from, what's the damage. It depends on, okay, how fast do I need to run to a medical doctor? Okay, you didn't need to make that big decision, but the thing is that you need to sort of identify the problem, because let me tell you something right now. If you have a muscle pain, for example, it almost everyone suffers from muscle pain and inflammation from time to time. Muscle pain can affect a small area or the entire body and can range from mild to severe. The thing is that if you identify it and you're sure it's a muscle pain, okay, you could do some things that I'm going to talk about later, but you need to identify it. Basically, the causes of this type of pains are common causes like strain, overuse, minor injuries. In general, this type of pain is localized and usually affects only some muscles specifically or a small part of the body, like your back, lower back, and things like that. Okay? Okay. So, but there are other common causes of muscle soreness. Have you heard about chronic compartmental syndrome? The one in your hand, for example, when you type a lot, huh? In your computer, for example, it started, you know, to hurt a lot, and the inflammation. For example, chronic fatigue syndrome. Have you heard about chronic fatigue syndrome? When you go to sleep and you're tired, and you wake up and you're tired, you're still tired. Okay, long coronavirus disease pain. Have you heard about that? Long coronavirus. You know, the disease is there no more, but this pain all over your body, or your articulations, your muscles, everything hurts. Fibromyalgia. Have you heard about that? We haven't, as doctor, 20 years ago, there wasn't even a name for fibromyalgia. We didn't know what it was. Now we are getting closer, but it's something that is affecting, I believe, 60-70% of the population, of the world population. Hypothyroidism, influenza, lupus, Lyme disease, the one that are produced by the bite of a tick. Okay, I don't know if you understand that Lyme disease, you can't get rid of the Lyme disease. You control Lyme disease, but you can get rid. Once it gets in, you need to struggle with it the rest of your life. Okay, I have some patients with that problem, which is very, very painful, and we are doing some amazing things, helping them to support the problem with nanocurcumin. Some common causes of muscle soreness also are, for example, people that are having statins for, I don't know, for example, high cholesterol and triglycerides. What happens is that this type of statin drugs causes muscle cramps, causes muscle pain, and we have other causes like polymyalgia rheumatica, polymyositis, an inflammatory disease that causes muscle weakness, rheumatoid arthritis, which is very common, sprains, repetitive strain injuries, etc. So, as you could see, pain is everywhere. Pain is everywhere. We need to understand that pain is part of our lives, but don't let it limit you. You could do something right now. We have an answer to the problem, and that's what I'm going to be talking about right now. First of all, we need to understand that there's a basic care, okay? Muscle pain that occurs during an activity usually indicates that there is a pull or strain or something like that. Okay, if that's the case, this type of injuries usually responds to RISE strategy. RISE is rest, ice, compression, and elevation therapy. It's very easy. For example, rest means take a break from your usual activities. Okay? Ice, apply it in an ice pack to the painful area for 15, 20 minutes several times a day. Compression, use it as a bandage, for example, to decrease the swelling. And elevation is raising the injured area above the level of your heart, especially at night, to allow gravity to help reduce swelling. This is the four actions that you could be doing, recalling RISE: rest, ice, compression, and elevation. This is for basically mild injuries and things like that. So now you need to run to seek medical attention if you have muscle pain with trouble breathing or dizziness, extreme muscle weakness, high fever and stiff neck, for example. Okay, you need to run to your medical doctor, okay, for him to make a proper diagnosis and to make an appropriate physical evaluation, okay? So understand these three things you need to run. But we also have natural alternatives, adjuvants, supportive natural products, very useful in cases of muscle contractures and things like that, like white willow, like menthol, camphor, curcumin, and ginger. Let me talk to you about quickly about the white willow. For example, it's known as the natural aspirin, salicylate. Have you heard it? It's like white, transparent. You put it in the area. White willow bark is used to relieve headaches, mild febrile colds, flu, muscle, and joint pain. It's been caused by inflammation, arthritic conditions, and systematic connective tissue disorders. In the other one, menthol, for example, it is known to provide a cold effect, which favors local vasodilation, which means more blood gets in the system and relieves muscle pain and shortening the recovery phase. Okay? Another natural suggestion is the camphor, analgesic camphor. It's oily and it's a common ingredient in pain relieving medication, including topical pain relievers. You could see it in a lot of them over the counter. It can help treat muscle aches and pains while stimulating circulation by interacting with receptors on sensory nerves. Camphor oil can also help reduce chronic muscle and joint pain for longer periods of time. And how about curcumin? Right now, I'm talking about the acute inflammation, okay? Curcumin is not only for chronic inflammation, as we've been talking before. It's also amazing for acute inflammation. For example, acute inflammation generated by intense exercise can benefit from curcumin's anti-inflammatory and antioxidant ability. It offers pain relief and can help increase physical range of motion and athletic performance. When I go to the gym, for example, there's a bunch of guys that goes to the gym with me. All of them are complaining. Oh, it hurts here, it hurts there, my elbow, my shoulder, my bursa, my knee. And I tell them, you're suffering because you want. Why? You have something for this. I can't have all of those pills because it hurts my stomach. And I tell them, no. Have you heard about curcumin? And they started to use it, and they started to feel the benefit. All this contributing to greater athletic efficiency and optimizing weight loss also. You know what? I found that we are extremely focusing our products only in health conditions. We are preventive, we are supportive. We need to look for the other 80 or 90% of the market outside, because they need it also. They are having chronic pain also, and they just think that they don't need because they normalize the pain. Okay, so let's keep coming over here. Heavy work or overuse injuries, for example. Amazing product, the curcumin. The mechanism of action is that the curcumin reduces the subjective perception of muscle soreness intensity. It reduces the muscle damage. It increases the muscle performance, and it has anti-inflammatory, as I told you, effect by modulating pro-inflammatory cytokines, and may have an antioxidant effect in it also. It's been published already. How to control inflammation through the COX-2 prostaglandins and interleukins, which, when moderated, play a role in inhibiting post-exercise muscle soreness. Another thing that you need to understand is when it's not coming from, going to the gym or performing in an athletic way, or, you play football, you play baseball, things like that. There's something else that is not because of an athletic thing. It's because it's pain coming from chronic inflammation, from an autoimmune problem such as osteoarthritis, which is the most common form of arthritis. Studies have shown that curcumin is clinically effective as a long-term adjuvant treatment of osteoarthritis, in addition to excellent tolerability. Why? Because the traditional anti-inflammatory drugs causes a lot of secondary effects in your liver, in your stomach, in your ulcers, in your intestines, etc. Okay. Another thing that the medicine pharmacy report is saying right now, when they make an evaluation of oxidative stress in osteoarthritis, they says that joint disease driven by abnormal biomechanics and factors derived from concomitant cells and tissues, the disease is multifactorial. It comes from several parts: metabolic, also from autoimmune, nutrition, genetics, multifactorial. Okay, but the progression is significantly related to oxidative stress and oxidation, ROS. And curcumin is amazing in oxidation and inflammation. It's amazing. So we have this type of support also. Another type of support that we have, that it's been published, is the oxidative stress as a cause of mitochondrial dysfunction. The mitochondrial dysfunction, the mitochondrial is inside your cell, and it's the responsible of producing the ATP, which is the main the main energy or the battery of your daily basis performance. You couldn't think, you couldn't see, you couldn't walk, you couldn't do anything if you don't have ATP. It's like the gasoline of the human being, and it's produced inside the cell at a mitochondrial level. When you have a mitochondrial dysfunction, everything just explodes, okay? In your cartilage, in your synovial inflammation, in your intracellular signaling, in your chondrocytes, in your apoptosis, it's everything starts going bad for you. And one of the things is pain and inflammation. Okay, so and also if you don't have the gas, you don't have the driven, you couldn't make enough you couldn't have enough performance to work the things daily that you need to do. That's why when you go to sleep at night and you are extremely tired and you woke up in the morning and say, okay, I must be ready right now, and you're still tired just as the day before, what happens? You have a mitochondrial dysfunction. You have a mitochondrial dysfunction. The energy just left your body, That's why when you talk to people about our nanocurcumin, what happens is that people, one of the first things they says is, oh, I'm focused. I have more energy. I sleep better. When I woke up in the morning, I feel amazing. Why do you think is that? Mitochondrial dysfunction. Okay, that's the basic explanation, easy explanation. Rheumatology. Rheumatology is one of the problems that affects all throughout the world and spreading out in the world, and it's an autoimmune problem. And you need to know two things. For example, if you're a coffee drinker, you need to understand that coffee possibly contributes to rheumatoid factor production. Okay, it could trigger the problem, and the salt in your diet, it's also against you. These two things most of the people didn't know. You need to understand that if you have a genetic a family tradition and this type of problems, rheumatological problem, you need to take a quick look about the coffee and the salts. Okay. Another thing is that we found, for example, chocolate, omega-3 fatty acids, resveratrol, capsaicin, which are products well known that are modulators of your immunity. And this is autoimmune derived disease. Okay. But there is one, which is curcumin, which seems the one that provokes the greater impact. Why? Because of the raise of antioxidants and anti-inflammatory at a genetic level inside the cell. Okay. And what happens is all that you're seeing over here. This is the last stage with Heberton nodes in your hand, for example, of class 4 osteoarthritis, degenerative. My mom used to have this. It's painful to death. Painful to death. You couldn't open a door. You couldn't open a can. You couldn't brush your hair. You couldn't brush your teeth. Anything. You're totally limited. Okay? And the ones who have this would understand me the better. So, in your knee, for example, the cartilage erosion, synovial hyperplasia, abnormal angiogenesis, synovial inflammation, a lot of changes in your knee are because of your autoimmune system attacking all of these anatomical areas in your knees. So as the same as in your hands, okay? So what are the strategy? But the strategy is, first of all, we need to reduce what? Reduce pain, reduce oxidative damage, reduce an excessive inflammatory signaling that damages the extracellular matrix and embedded chondrocytes and off articular cartilage. okay? Bio-MS curcumin, for example, is the ideal nutraceutical formula for controlling oxidative stress. Why? Because it is absorbed. You could have curcuma or curcumin from outside, and what happens is that it is not absorbed. It is not absorbed by your brain barrier. It is not absorbed by your intestine, small intestines. It is not absorbed by your articulations. It is not absorbed by your eyes. For just to mention some, okay? That what happens is that this nutraceutical formula for controlling oxidative stress, regulating inflammatory signaling, and enzyme activity involved in the progression of osteoarthritis. Why? Because it is immunomodulatory. It modulates the immune response. And if you're attacking yourself with your immune system, it means that you modulate that response, and then you are making a difference for the developing problem that you already have, okay? The other thing that we need to do is, wait, it goes to the next one, restore. We need some other things to help restore. We could reduce, then we need to restore also. Collagen, for example, the joint mobility using type 2. I could add type 3 also, collagen, and hyaluronic acid supplements, which are in clinical trials to increase mobility and joint function. It's been studied already. And other products such as glucosamine and chondroitin sulfate are also provided at a clinical doses to support joint cartilage structure. Support, always supportive, okay? And this helps your body to restore. It gives the main ingredients for your body to restore the functions. Now, we're going to talk about repairing, okay? First, we reduce the pain and inflammation, then we restore, then we repair. Cartilage synthesis, for example, should be facilitating by improving what? Mitochondrial function and cell survival of chondrocytes. Bio-MS curcumin is the mitochondrial support formula enhanced to protect chondrocytes from oxidative stress and facilitates mitochondrial biogenesis. Could you imagine that? Mitochondrial biogenesis. We are producing, we are repairing. Okay, other research backed up nutraceuticals, supplements to improve osteoarthritis. For example, omega-3 fatty acids, amazing. Vitamin C, vitamin E, and vitamin K. All of them are mentioned that helps repair. But the best one, the superhero here is the Bio-MS curcumin, okay? Okay, we also have ginger extract. We mentioned it at the beginning, okay? It contains some types of biomolecules with difficult names like gingerols, chogols, but they work inhibiting COX-2 pathway, which drive us to inflammation and pain, mediating synthesis of pro-inflammatory cytokines. Immune responses known to significantly increase in osteoarthritis pathology. Curcumin Plus also provides vitamin C and ginger extract. Okay, that's why it's amazing also for this. And last but not least, just almost finishing here, we have vitamin D. Vitamin, which is no longer a vitamin, it's not well said. It's a pro-hormone for the medical area right now, the vitamin D. It contributes to the normal absorption and utilization of calcium and phosphorus to the maintenance of bones under normal conditions, to normal levels of calcium and blood in the blood, and to the normal functioning of muscles, teeth, immune system, etc. Vitamin D has to do with all of this, with metabolic area, immune area, cardiovascular area, neurological area. You just wouldn't believe all the areas the vitamin D has to do with. Okay, so we need to understand that people who have low levels of vitamin D often have plenty of types of pain. For example, joint pain. Vitamin D supplements can treat joint pain also in some people who are deficient in vitamin D. Our products are not a treating option as a treatment for the people with a lack in vitamin D, okay? We only provide the 60% of the recommended daily allowance, RDA. That means it's a small amount. If you have a real problem on vitamin D, less than 30, for example, between 30 and 40, you're sort of good, okay? And optimal is between 40 and 50 in the level. But if you are 30 or under, you might have a therapeutical amount of vitamin D provided by your medical doctor or the doctor that is treating you, okay? Curcumin could provide an option, a support in neuropathic pain, remember, and the inflammatory pain. Also, we have the text neck syndrome. Just to end with this, the text neck syndrome, it's a modern problem. Yes, it's because of the technology. Okay, your laptops, your cell phones. Have you feel that you're 80% of the day in this position? Okay, what happens is that the text neck syndrome causes a forward head posture, as you could see in the X-ray over there, and it can cause permanent damage like headaches, back pain, muscle damage, nerve damage, spinal disc herniation, decrease in spinal curve. You could even have a problem in the loss of lung volume because you know the oxygen, the oxygenation when you breathe because of the position. This is difficult. Try to do this. It's difficult. The loss of lung volume capacity because of the text neck syndrome. So another thing is the migraines. The findings indicate in this study that I've read that the combination between nanocurcumin and omega-3 fatty acids can be considered today as a promising new approach in migraine prevention. It's been published over there, as you could see, since 2019. It's amazing. I had a lot of patients with this kind of problems that just came over to me and says, I don't have to stay 2 days inside my room anymore with no light, with no sounds. Huh? I don't know how many of you have suffered of these severe migraines, but we have an option right now. I had this patient also, which is the aunt of a friend of mine, and he asked me that if she has a very painful foot, as you could see, a neuropathic problem with his diabetical ulcer in her foot, which is a complication, you know, in diabetes. And I tell them, okay, give it a try. I'm not sure. I'm not sure if we're on time, but give it a try. You know what happens 2 months later when she reaches her doctor, he couldn't believe her because he was getting ready to put her in a surgery room and get her foot off. Okay. And more amazing than the testimonial is that the science already find out how does it works, How does curcumin works as an antibacterial, anti-inflammatory, suppressing all the problems that appears in the diabetic foot ulcer complication? It's been described. It's over here. Look, multiple biological actions of curcumin in the management of diabetic foot ulcer. So we've seen it as a testimonial, and we also have the science with us. Okay, don't let the pain press down on you. Don't let the pain press down on you. You have options. You have options with proven effectiveness, decreased pain, inflammation, no undesirable effects. You have something amazing in your hands with just 10 drops a day. Everyone can take it. Elderly people, young people, even the pets could use them. Okay? And also remember a balanced and nutritious diet. Add magnesium for your pain. It's amazing. Magnesium. Don't forget about exercise. Don't forget about exercise. I don't have any more time right now. Hydrate. Hydration is very important to living a life painless. And provide a protection against oxidizing agents. You have the tool, you have the product, you have the science with you. You understand that you have all of this. All of this. What do we need to do now? We need to go out there and become part of this amazing crowd of people in Australia, in New Zealand, in Europe, in the US, in Latin America, including Mexico and all downstairs through Chile. You know what we're going to do? We're going to become an army with knowledge and support for millions and millions of people out there living in pain. Thank you, Dave, and thank you all for your attention.
Thank you, Dr. Cesar. Thank you, everybody, for being on this call. We love having the professionalism and everything that we get from Dr. Fernandez, his background with Shane and with science in general, medicine specifically, and now obviously with Nanofy and Curcumin Plus, and our product lineup makes it a critical element that we get to use, that we have in our arsenal. I'll call it an arsenal because he talked about having an army. But this is what we use to help people understand what is available to them. So all of you on this call, make sure you utilize what you learned on this presentation to introduce it to someone else. Talk to someone, just give a little, I love picturing Steve Keller because he's one of our highlights for approaching new people. He has no inhibitions. That doesn't mean he's careless and just wild with inviting people. He'll just strike up a conversation. Oh, what do you do? Oh, well, I recommend a product that helps people feel better. Instantly, people perk up. And if you have that available, you should make it available to everybody else as well. 7:40 p.m. in Utah. So it's a great 40-minute call. Thanks to Dr. Fernandez. Thanks to everyone for being on with us. We wish you a great Wednesday if you're already there, Australia, New Zealand, and the rest of your Tuesday night if you're in the U.S. and Canada or in Latino America. And if you woke up early to listen in from Copenhagen or Amsterdam or points in Europe, please go back to bed and then watch this recording tomorrow. Thanks, everybody. Have a great night and a great day. Bye-bye.